So
Right.
in your practice and in your office, how does that work? Because you've got a lot of those tools already in the toolkit. I mean, what does it look like in your office when somebody comes in? Do you have enough doctors within your office, or are you collaborating with doctors in your area, or how does
No,
it look?
the one thing I'll say that's quite different about our practice from every other practice, and a lot of patients call and they say, I'd like to see Dr. So and so. You don't have a choice in that here, meaning because everyone works together as a team. Every morning, it's a team effort. You don't have access to one, you have access to all of them. Every
Nice.
single case that comes in here is a team discussion around a table. Like I said, instead of actually putting the patient sitting there on the table physically, it's their chart. It's everything about them. It's their, assessment. It's everything you heard as different practitioners when you spoke to them. It's all of that. So you have access to everyone. My father's only in office maybe once a week or twice a week to meet with patients. He's working every day on patient cases though. He's still full time, and everyone's like, oh, he's slowed down. I'm like, I think he's sped up. He has 50 cases to review, over this week. So it's always about, I think, looking at it not as this doctor will give you his opinion or this doctor will formulate his protocol. And if you went to another doctor in the same center, you may get a totally different protocol. This is the team effort. This is our innovative medicine protocol, not Dr. Schultz, not Dr. Ivanitsky, not anyone else's here. And then you have access to everyone there. You're going to meet with the psychologist. You're going to meet with the doctor some. You're going to meet with the clinical director who specializes more in the energy medicine side. And they'll all apply their specialty to you, understanding that everyone else, what else you did. Oh, you already had that nutritional IV there. This is going to work very well to help optimize that. And I could see in your results that you needed this works very well. So I think that's a big part of how we are able to do this efficiently. And I think systematically, always looking at it from different perspectives and knowing that we're giving you multiple viewpoints. We're giving you multiple angles. We're looking at this comprehensively, not just in your biochemistry but also psychologically. So it's all these different things that come together to give us basically what we say is like a true interaction conversation with your intelligence, not just with you. You may not know that relationship that broke down when you were little is still impacting you and actually having an effect on your biochemistry and causing this dysfunction. But
Right.
your body knows that. If we could tap into it and have that conversation with it and then meet as a group of practitioners and doctors with so much experience and so many different trainings and everything that go into it. It's not just 40 plus years of my father there. It's over 100 now, a few hundred years of experience looking at your case.
Looking at that.
And while I'll say it's probably a little slower, right? If every doctor here were just given their office to speak with a patient at the same time, it would probably bring in more, but I don't know if the results would all be the same. And the more minds you have around it that are truly trained in this, and always we're looking at dynamically training them. We do training on regular basis here. We'll stop seeing patients early just so we could do that, bring other people from around the world into the clinic to say, train more. So we have a bigger awareness field so that when the next case comes up, maybe someone picks up on that and says, okay, I'm seeing this is a good one too. And we all come together to say, okay. So this team effort, and again, you see it in sports. It's like, yeah, you can have one rock star on it, but if you don't have the team effort, you're not going to win that way. So I do think that medicine needs to work in that way. In many ways, it kind of is, where you're seeing these kind of larger centers that are cooperative a little bit, but I still think it's, oh, you'll be meeting with Dr. So-and-so and they'll give you their protocol. And then, just the nurses kind of follow that protocol without much input. Here, the nurses have a ton of input on that. So everyone does, and everyone's kind of dynamically looking at as well. How are you adjusting in the first week or so? And then the input comes from multiple angles as they are treating the patient, which also helps to understand the progress, what can be changed during it, because everything's dynamic. As you start to peel the layers of the onion back, other things show up.
Very good. In that, it sounds like you're treating cases that are many times complicated, difficult cases. Are you also treating on a wellness type of approach?
It is both. We have people that come here for the wellness perspective, preventive, just regenerative. We have an anti-aging division here where we utilize a more inside-out approach and no chemicals and kind of surgical procedures. However, I have to say, this is America. I think most people wait till they have a problem before they address it, right? If it ain't broke, don't fix it kind of mentality.
Unless it is the athlete,
Oh, yeah. The athletes are wonderful because they're just used to that. They're used to pushing themselves and they're used to a coach, right? We love the athletes because they are so compliant. You tell them this is your diet for the next 4 weeks. They do not break that diet. Someone else, they'll admit, I had some wine here, some of this,
Exactly.
But yeah, it's a lot of complex cases, especially, this is out of pocket. This isn't covered by insurance. So a lot of times what you're going to see is someone with a symptom that years develops into chronic, would never show up here. But as a last chance, without that insurance there, they come here. And unfortunately, by then, it's a pretty complex condition. It's had years and years to kind of manifest. And in many ways, the different approaches, whether it's years of antibiotics, also makes it a little bit more difficult and longer to then get back. You have to see it as the longer you have something, the longer it's going to take to resolve. If you've been suffering with something for a very long time, you can't expect it in 2 weeks to be all gone. Meanwhile, if you caught it early, and maybe a few weeks would be good. But the complexity of cases also, I think in general, are just, in this day and age at their highest, meaning they're most complex. It's never one or two things that are causing this. It's a whole handful of things here, from the stress to the EMF to pathogens to nutritional deficiencies to energetic meridians, all of these things. And it's like, well, you got to go one at a time. It's a little bit of a slower process, but we'll address each of those.
So you have your practice in New York. Is this model something that is starting to show up in the United States anywhere else, or across the globe anywhere else? Is that part of the vision?
That is definitely part of the vision where we're going. I'd love to see this elsewhere. And again, this isn't to say there are many wonderful practices out there that are similar in this respect. I mean, we are close. We refer to the Paracelsus Clinic and Dr. Rao's clinic out in Switzerland, which is a very European biological, does a lot of things. And of course, there are different practitioners across the United States that offer different but similar service, I would say. But we would love to see this become something that is more accessible, and something that we do have throughout. We've been talking, that's why we built out a management services organization, so that we can expand this to other locations and use the blueprint we have here to open, whether it be California, whether it be Florida, elsewhere, that we know it would be easier to get to, of course. It's always difficult when you're traveling and you're sick to go someplace across the globe, even, or across the country, and get treatment. And of course, we have to approach it a little differently because we don't have access where you could just drive here and stay for weeks at a time. So the vision would be, of course, to expand this, but even more so, the vision would just be to expand the awareness among people. Too many people I speak with say, I'm completely out of options. And I ask, what have you tried? What have you done before? I went to a conventional route. I saw, an acupuncturist, and I'm out of options. And I go, my God, you've got so many options. We have over 100 therapies here. You tried maybe 3 of them so far, right? Right. But if you don't know that there are 100 options, if you don't know about this approach, of course, you're limited. You're limited to what you know. And unfortunately, most doctors say, hey, we're out of choices. We tried surgery. We gave you the pills. We did this experimental one. It didn't work. Sorry. Good luck.
Right.
When we know there are doctors such as yourself and others all around that are doing wonderful jobs and increasing those therapeutic options to provide people with the solutions that may be the ones they require to get their health back.